Hi, Clark. How are
Hi,
you?
good. How are you?
Good. I'm glad you came back in to see us today.
Yeah, I'm excited. The last visit was good. It was good.
Good. And we just did kind of a brief overview then, so we'll get really down to a lot more business and kind of encompass everything that we've been discussing in that as well, okay?
Awesome.
So what I'd like to do first is really kind of go over what we did last visit. So our anthropometrics to see kind of waist-hip ratio, your body weight, things like that as well. So we're going to go over that, but first what I'd like to know is kind of just reiterate to me what are some of your biggest complaints and concerns of coming to see us today?
Yeah, perfect. My three main complaints would be fatigue. I feel that throughout the day. I don't know if I'm not sleeping well, and then another factor might be because I'm stressed out at work with meetings and deadlines.
Yeah.
That might all go together. And then my third, so it'd be fatigue, and then nervousness as well as constipation. And so I don't know if those tied together, but I noticed that those three things have come up frequently throughout the past couple months and years, and so I'm trying to get over that and hopefully get back to what I used to be like.
Yeah, so those seem to be like definitely your most main issues
those are the
that
main
really
issues.
need to be taken care of. So what I'm hearing from you is that definitely fatigue is a big issue, especially at work when it's really busy and crazy at work. You need to have energy, right?
Yeah.
So we'll definitely address that. I think you are correct that a lot of these things can be interrelated. So your constipation may be related to your anxiety at work, and vice versa. So we will discuss kind of some of our ideas and recommendations for you of how to address that. And we'll go through it together, and I want to get your feedback as we go to make sure we're on the right track. Okay?
Absolutely. Perfect.
Okay, great. So to go over the anthropometrics that we went over last time, so your weight was really good. You had a really great body mass, body fat percentage, and then your hip to weight ratio was all really good. So I don't think you need to work on that at all. I think that's totally fine. Is that okay with you?
Yeah.
Okay. So I think that's good. Your basal metabolic rate was, we calculated out with your activity factor being very active, that it was quite high of a caloric intake, about 3,000 calories. So that's something we'll talk about too when we get to your diet plan, discussing that to make sure that we're getting enough calories. Because sometimes when we don't get enough calories, we can be more fatigued too, especially since you're working out so much and your body's blowing through those calories too.
Never thought of that.
So it all depends on the right type of calories, right? But making sure you have enough is also important. Okay. So we'll discuss that more in detail as well. So I think that way your blood pressure was good. I think in that regard, the anthropometrics were really good. Your physical exam, we did find a couple of things. So remember the striated nails you have. So it could be like a folate and niacin issue, some B vitamins that we'll probably incorporate in. The dryness around your fingers, some people like to call them hangnails, or a lot of skin that flakes off around the nails. Usually it's an essential fatty acid issue, so that's another thing we'll supplement with as I talk about the program later. And then the other thing is that we saw is a little bit of the white coating on your tongue, the back of your tongue. So it wasn't super thick, but it does tell me that there are some bad gut flora in there, meaning we got to really supplement with maybe some good probiotics to do that. And we'll talk about that as well. Okay? Okay, does that sound okay so far?
Yeah, that sounds good.
So yeah, we just kind of discussed last visits, and let's talk about your nutrition intake that you gave to me in your diet plan. These are really great. These are really gems to me to be able to figure out maybe some of the causes that are going on, and it lets me kind of see into your life a little bit more than just asking you questions. Okay? So. Your food log, I did see some correlations in it. So definitely I think you are eating a lower calorie intake than the 3,000 that's recommended. So I'm gonna give you a diet plan that makes sure you have enough calories too. Okay? You do eat a fairly healthy diet for sure. There's a couple of things in there that I see that you noted in your intake that you might have some sensitivities to, that I still see coming up in your diet plan. So that's another thing of maybe avoiding the dairy and the gluten that you might have sensitivities to as well. And then just trying it for about 3 weeks to see how that works, okay?
Okay.
So we'll go into that as well. But a question I had about your diet, I noticed that you don't eat after dinner at all. You're pretty good about that, which is a really good habit. Do you have any issues with eating later at night?
Yeah, I try to avoid it as much as I can. Obviously, there's time constraints and different things that happen with work, and sometimes I don't have dinner until 8 or 8:30, and it's usually after 7 if I'm having a bigger meal. My stomach has more of a problem digesting it, whether that's before I go to bed or when I wake up. I have a stomach ache, and so that's something that's kind of why, hopefully on my food log you've seen that I try to avoid that as much as I can.
Yeah, which is great. I do see that you avoid it. And that's a great point that you bring up about not digesting your food. So that also gives me a really good clue of maybe what's going on at the same time. So I'm glad you brought that up. That's really important.
And then I have a question for my if I'm supposed to have more calories and obviously healthy calories, how can I do that? I have a lot of meetings. I'm on the go. I'm stressed out. How can I make sure I'm getting those calories in that time span without having to eat after that time? And
Great
you know
point.
what I mean?
Yeah.
How it all works.
Yeah. So in the diet plan, I will include. I think the biggest thing, especially since work is really crazy, is making sure our 3 main meals are bigger. Okay. So when we do have time to maybe sit down for lunch, even if it's a 20-minute break at work, that it's a larger meal. So it'll sustain us through that time. Yes, snacks at work, whether it's, not sitting at your desk, something that you can eat while you're at your desk, and maybe something that you can leave there at the same time would be a good idea.
Okay.
So it's not something you have to pull out of the fridge all the time or things like that. So definitely that's a really good point. I'm glad you brought that up. How to incorporate that, and that's one of the obstacles probably we'll try to fight through this. But I think the main thing will be making sure our 3 main meals are larger. Okay.
Perfect.
And then before and after workout too. That's also will help increase the caloric intake. Okay. Thank you for asking those questions. Okay, so diet plan. So let's move ahead into kind of our treatment plan that we would recommend for you in particular. Okay. So like I said, we're going to address some nutritional ways, so some dietary recommendations, as well as some lifestyle things, because I think they both go hand in hand, but they're different in their own separate ways. Okay. So the dietary plans, like I mentioned, we're going to go off of the gluten and dairy. So have you had experience completely going off of those before?
I've done it for a week span here and there, but not past that.
Okay, good. And it really, the best way to tell is going 3 weeks or more.
Okay.
So that's another good reason maybe the week kind of just let your body know just a little bit, saying, okay, I noticed that I have a sensitivity to it, but you're not fully getting rid of it out of your system. Especially gluten takes about 3 weeks to get out of the system. So it takes quite a while. So what we'd recommend is making sure you go off of both of them for 3 weeks. And then after that, we'll add one back in at a time. We'll add it in for about 3 meals in a row, just for 1 day, and then come off of it again and see what your body does. If you're sensitive to it, your body will let you know. Whether you have headaches or more constipation. Some people get anxiety from certain foods as well. So you'll know if you have a sensitivity, and if you don't, you won't feel anything. So it's a good way to test without actually having to do blood tests. Okay. In regards to dairy intake and gluten intake, I did give you, the ladies are going to give you handouts up front of how to go about doing that. To make sure that you know what things are dairy and what things aren't. Big part of this is reading more labels as well. So nutritional labels on the back of anything that's canned, boxed, anything like that. So we'll definitely you eat more of a whole food lifestyle anyways. So I don't think it will be as hard. It'll just be like eliminating cheese and ice cream and things like that. Okay.
What would you recommend instead of those things? That's something we'll cover later.
Yeah. No, we can talk about it right now. So cheese, there is not a great recommendation. Most of them are made out of soy, some of them rice, but a lot of chemicals mixed in with them. So I'm not a big fan of cheese substitutes. So cheese, I know it's one of the hardest to come off of. I really would just recommend getting out of the diet and making sure you have more flavors in your foods and things to make make sure you really still enjoy your meals.
Mm-hmm.
Ice cream wise, yes, there are definitely dairy-free substitutes that are great. They're phenomenal that they've come out with a lot better ones lately.
Awesome.
So that shouldn't be a problem.
that'll
You
be
can still
good.
have your treat every once in a while. Not a big
Do you
deal.
think they'll ever come out with cheeses that are?
I do.
Yeah.
I think they will come out with more in the long run, but just for right now, they haven't really. So, so that's the first dietary thing. The second dietary thing that we're going to work on is supplementation wise. So supplements, we're going to start a good probiotic, which a probiotic helps with the good flora, the gut bacteria. Since we notice we have a little bit of overgrowth of bad bacteria. Then we're going to do some essential fatty acids. So I'll do like a cod liver oil that has some vitamin A in it as well. Okay. And then a digestive enzyme, because I think one of the other things that might be going on is that when we digest our foods, and if we're not digesting them correctly, we could also have mood imbalances like depression and anxiety, especially with protein. So when we eat protein and then it digests, it turns into amino acids. And those amino acids turn into neurotransmitters, or we call them mood stabilizers. Okay. So if we're not digesting them correctly, we're not able to use them inside our brain either.
Yeah.
So that's another reason why I think that we need to make sure we're digesting our protein, because that might right there handle the anxiety at work, right there.
Yeah.
Okay. Along with protein digesting, if you're not digesting it, you also usually get B deficiencies. And your lab results do correlate a little bit with that, and we'll talk about your labs in a second. So that's the last supplement we'll add in as well, some B vitamins, especially B12. Okay. So that's the dietary goals. On a scale from like 0 to 10, how confident are you of being able to do those things?
Probably
be honest.
Yeah, probably a 7, just because I've done it for a week before. I can do it for at least 2 more weeks and then kind of see how my body's reacting. Is there any way maybe after those 3 weeks I can maybe start adding in a little of dairy and gluten, or would you recommend not?
Absolutely, yeah. That's what we'll do. So I'm going to see you again in 3 weeks after this period, and I'll teach you how to add things back in. And we'll see what your body likes it or doesn't like it. And sometimes people like certain dairies. Like, so for instance, some people can handle like raw milk, or like raw, like aged cheeses, like goat cheese, feta cheese, Parmesan cheese, but they can't handle the more soft cheeses. Okay. So we will also try those as well to see which ones maybe you can handle, which ones you can't. Okay. So on the scale of 7, so some of your obstacles maybe just time as well.
Yeah, that was my one thing. I think it's always quick to always be able to add, some cheese sticks or something as a snack here and there. So maybe just being better organized with my time and just having those 3 meals set out and.
Yeah. Do you think it'd be helpful for me to give you like a handout of like maybe snacks or go-to things?
Yes, that would be helpful.
Great. Yeah. I will make sure that you get one of those as well, and that will really help, because sometimes we just don't know what to eat because we're so used to the same things.
Yeah.
So definitely I can help with that. So hopefully we'll get you a little bit more confident as we keep going. Okay.
Perfect.
Okay, and then the lifestyle things that we're really going to work on. The first one is we're probably going to do some supplementation at work just to have a little trial. Have you tried anything like tryptophan or L-theanine before?
I've tried a little bit of both. I think my body likes the theanine a little bit more than the tryptophan.
Okay.
I don't know if the tryptophan had as much of an effect.
Okay, so that's a good I'm glad you've tried them, and maybe we could try the theanine then at work when it just, at least on like really stressful days.
Yeah.
And I know sometimes it can be hard to remember those to like actually take them. So we'll maybe set alarms in your phone, things like that. Especially, I think the best time to take it would be in the morning around 8. I heard you go to work at like 6:30. So that there's not a lot of food in your stomach, but then also that it's kind of when the day's ramping up a lot.
Yeah.
Is that usually how it goes?
Yep.
Okay. So that's the first lifestyle thing. And the next one is A little bit harder, but I think definitely doable, is to make sure we take breaks at work. So, as you shake your head, yes. Whether it's 5 minutes, whether it's 20 minutes, whether it's 10 minutes,
Yeah.
making sure you take some breaks at work, and then really separating lunch from break, like lunch from
Yeah.
working. So not work. Go ahead.
Yeah. Would a break be like a bathroom break? Is that what you're? Because that's kind of what I seem to find time is obviously if I need to use the restroom, that's the
Yeah.
time I use it, and then it's hard to kind of get time. Obviously, it depends on the day and the meetings, but to get kind of a 10-minute break here and there might be hard without just having, okay, here's my 20-minute lunch. I have that every day, but other
Yeah.
than that, it might be hard to come by.
So how long are usually your bathroom breaks?
5 to 10 minutes.
So what if we take your bathroom break and then tag on to your bathroom right after your bathroom break, another 5-minute break? Like where you either go get some water or you get a snack, but what I'd really like you to do is do some deep breathing. So you can do that standing up, you can do it sitting down, and I will walk you through the process of how to do deep breathing and also give you a handout of how to do it. But what deep breathing does is really help decrease your sympathetic nervous system. And your sympathetic nervous system is the one that's our fight or flight. So that's our really stress building system. That's where cortisol comes from, and especially at work that's high stress, we usually ramp up our sympathetic nervous system. And what deep breathing does is help decrease that sympathetic nervous system and helps increase the parasympathetic. And parasympathetic is our relaxation mode.
Yeah.
So that's the one we do want to increase, at least intermittently in between work, so that we're not on a really high go pace the whole time, which can also help with anxiety when we lower that a little bit.
Yeah.
Okay.
Okay.
So maybe before or after your bathroom break, do you think that's a possibility to maybe do like 5 minutes?
Yeah, I'll see what I can do. I'll try my best to do that. I think if I stay away from my office, maybe after I use the restroom, maybe get a drink and kind of go somewhere else for a little bit. That'll
Yeah.
be easier than going back to my desk.
I think that's a great idea. I really do, because when you go back to your desk, there's work.
Yeah.
So I think that's a good point. I think that's good. Okay, so those are the dietary and the lifestyle things. Definitely continue exercising. I think that's great. It's a good stress reliever as long as you feel good and not too fatigued. That's important as well. Okay. Any questions at all with the treatment plan so far?
No.
Okay, great. So we're going to work on these few things first, but I want to kind of give you a roadmap of where we're going and maybe some suggestions down the road.
Yep.
I don't want to pile it all on you at first because I don't think that's feasible, especially with the busy lifestyle that you have. So the other things that I'd like to consider maybe down the road, if the gluten and dairy does not have much effect on you and you're still having constipation issues, we might do a stool test. We might also do a food sensitivity test to really see, do you have other food sensitivities, maybe like eggs or soy or anything else in your eating that you eat that may be causing it.
Yeah.
The stool test can tell us if you have like candida or yeast, or parasites or lack of good bacteria, things like that. So those are some areas we might go down if this doesn't fix it. Okay. And then going along with that, I did go over your lab results that Dr. Wright sent over to me as well. I did notice that your thyroid hormone isn't producing optimally. So there's a difference between the ranges that the lab produces is a wide range like this. And I really like to find what's the optimal range for a normal human being at such and such age. Okay. And usually that's much more narrow area than their large range. Okay. So you're all within range, but not optimal. Okay. Your TSH, which is your thyroid stimulating hormone, was on a little low optimal as well. But you're definitely the ones that made me think of the most is your free T3 and free T4, which is really saying what your thyroid is producing. Okay. What your thyroid hormones are actually producing.
Yeah.
And both of them are low. So it could be a matter of cofactors like different nutrients that we need, like selenium or iodine. But since they're both on the low side, I'm guessing you need a little bit of, not iodine, but thyroid, and to see if that can give you a little bit more energy. Okay?
Okay.
So I'll give you another assignment of going to your physician, and I'm going to actually fax over my recommendations back over to him
Okay.
so that he has a good idea of what we've discussed, and maybe asking if he could try a little bit of thyroid on you as well to see if that would help with your energy levels, okay?
Awesome.
Your RT3, which is your VERSE T3, was a little elevated, which could mean adrenal fatigue. And really, adrenals and thyroid go hand in hand. So both different hormones that interact a lot with each other. So that being said, they really you can both have problems with both or just one or the other. So I do think we should try the thyroid. Along those lines, we probably down the future probably need to get a salivary cortisol test done to see what your adrenals are doing.
Okay.
And so we could just really test to make sure that they're producing enough or they're not producing too much, and we could lower them, things like that.
Okay.
Okay.
Perfect.
So that's kind of the outline of where we're headed, past these few things that we're going to work on these next few weeks. So I'd like to see you again in 3 weeks, right before we start introducing. So I'll walk you through again of what we're going to introduce, what things first introduce, and how to do it again, to make sure that you're on the right track. And then we'll really also reevaluate to see, okay, how's the constipation? How's the energy? Are you any better? Are you a little bit better? I really want to make sure we're tracking the progress, okay? Because I really want to see you get better. One thing I'd like to definitely mention before you go is that no one's perfect, okay? So you might not be absolutely perfect at going gluten and dairy free right away. Obviously, the better you can do this, the faster that you'll be able to see the results. But I don't want you to get down on yourself either. I notice that you are much more of a planner and you really like to get things done in a timely manner. So I don't want you to be too hard on yourself too if you don't do it perfectly right away. You just do the best you can. If you have issues, call me or email me. We can also meet again to say, hey Becca, I couldn't get over this hump. What do I do? And I can help you find strategies and ways to help you get through it. Okay. It's important to come back and tell me about it because then I will know how to help you better too. If you never tell me, we won't know that there's an obstacle in the way.
Yeah.
Okay. So does everything sound okay? Does it sound like a good plan?
Yeah, it does.
Great. So hopefully by the next time we see each other, your constipation will be gone, you'll have a little bit more energy, and hopefully the anxiousness will be done.
That'd be awesome.
Okay. Great. Okay. Well, I think that's it for today. I will have the girls make sure you get all the handouts and then the dietary recommendations. So the menu plans as well as the snack handout that we talked about. They'll make sure you get that, and then they'll also grab the supplements for you as well. Okay.
Perfect.
Great.
All right.
It was good to see you
Awesome.
again. Thank
Thanks.
you, Clark.
Thanks for your help.